Okay, so just to introduce myself and then I'll turn it over to my colleague. My name is Elizabeth Brewer. I am the Director of Research and Care Transformation here at Kootenai Health and co-chair of the Caregiver Wellbeing Committee. And so that role brings me here today to help continue to discuss the different ways that we can care for each other and for our patients in an inclusive culture of belonging. And I'll turn it over to Dr. Peterson to kick us off.
Yes, thank you everybody for joining. So my name is Emily Peterson. I'm a nephrologist here at Kootenai and co-chair with Elizabeth for Caregiver Wellbeing. And very excited about our topic this month for inclusive care. And we have three amazing speakers I'm very excited to introduce. I'm not sure if Dee Jansen is on yet. If you are on, please say something, but if not, then I will go ahead and introduce our first speaker, and then once Dee is able to join us, she will kind of jump in. So our first speaker is going to be Dr. Kate Aguirre. She is hopefully I said that right. I have the pronunciation. I still am not 100% sure. Aguirre, I believe, is a family medicine physician working at Mariman Health. She's from New Mexico and completed her undergraduate and medical school training at the University of New Mexico. In New Mexico, she developed an interest in caring for rural and Native communities. She moved to Coeur d'Alene, Idaho, and completed her family medicine residency at Kootenai, graduating in 2018. Dr. Aguirre has been working for the tribe for the last 5 years. She enjoys practicing full spectrum primary care and working for an organization that is providing quality services to those in need. So thank you so much for joining us, Dr. Aguirre. And I will turn it over to you. I think we have your slides up.
Awesome. Actually, the slides are for Dave, so I'm just
gonna talk. Sorry. Okay.
No worries. Thank you so much for having me. It's really great to see you again. I enjoyed working with you and a lot of the other specialists at Kootenai during my residency training. And so it's awesome to kind of still have a connection to Kootenai. So thank you so much for having me. So yeah, I've been working at Mariman Health down in Plummer for the last 5 years. I went there right after I completed residency. I did some rotations down there during residency. And so first off, like, I'm not the expert of all experts, in caring for Native patients, but I do feel like I've definitely learned some things in my time working down there, mainly kind of from trial and error, and so I'd love to share that with you because what was interesting to me is when I started working down there, there's quite a few patients who, when we needed to transfer them to the hospital or refer them to specialists, they really had an aversion coming to Kootenai and would prefer to go to, Sacred Heart or to the Valley. And so, I obviously really have a lot of great things to say about Kootenai. I know a lot of the providers there, the nurses there. And so I was just kind of wondering, like, why that is. And I think Dee is going to be able to share some like patient experiences with you guys as well. But I thought that was really interesting and kind of learning more about that and really trying to build those relationships. So I was thrilled when Dr. Peterson, let me know that we're having these inclusive care lecture series. So I guess first off, I want to start kind of just with some of the like challenges or stumbling blocks that I had when I was first starting down there. So one of the many ways that I kind of put my foot in my mouth at first was assuming people's relationships. So like, for example, there's a child in with an adult for a well child check and walking in the room and like, oh, is this your mom? Nope, it's grandma or it's auntie. And so, just kind of the way that I've learned to navigate that a little bit better is by just kind of asking and clarifying people's roles. And so Dave has a good way that he does this. He'll kind of turn to the kid and be like, so who'd you bring with you today? And they'll be like, that's my auntie, or that's my yaya for grandma. And then also kind of, related to that is, I kind of grew up where it was really just my own immediate family that was really involved in like my care as a child. But in the Native community, the extended family is much more involved. And so oftentimes, grandparents are, either primary caregivers or like very involved secondary caregivers. Um, aunties who may be related by blood, may not even be related by blood, can be really involved, cousins. Um, and so I think just kind of realizing that, the idea of family is a lot bigger than sometimes what we might initially think. Um, and so I think how that can be translated into the hospital would be really welcoming any family members that are there. It's okay to kind of clarify roles and who's related, but just that, we might all not feel like, our aunt or our grandma needs to be with us when we're in the hospital, but like those family members are often taking a really active daily role in people's lives. And so having them present there can be really important to people. Um, Another thing that I noticed that was different, especially with some of the tribal elders, was the level of eye contact. And this was something that kind of took me a little bit of getting used to, especially the elders, kind of a sign of respect can be kind of putting your eyes down, looking down. And I'm used to having a lot more kind of direct eye contact. And so that was something that I needed to adjust a little bit and kind of just watching them and their body language and their level of comfort, and then me trying to match that. And so, sitting down, kind of just having a posture and just watching what they're doing rather than coming in really loud and standing up, kind of standing over them. I just started being more aware of, my tone, my posture, my eye contact, and trying to kind of match what they were doing. Um, the other thing is kind of the amount of silence as well. If you guys can't tell, I am a talker. um, I tend to like talk a lot, and maybe I'm not as comfortable with like long pauses or long silences. And so a lot of times, like I will literally, it's harder now that I'm not wearing a mask, but I will literally like bite my tongue and just wait, and then maybe wait a little bit longer than I like feels comfortable to me, and then they'll respond with something that's maybe really important for me to know. And so just giving that little bit more time sometimes can make a really big difference. Another thing is just trying to listen more than you talk, which I think is also, sometimes hard for us, especially as providers. We have limited time. We're kind of coming into the appointment with our own agenda of like, I want to accomplish these things. And, sometimes the patient might have different things on their agenda, or, different things that are more important for them to share. Like for example, I've had, a patient come in for like a diabetic hypertension check, and that was like my agenda. We're going to review meds, look at your labs. And then the patient shares with me that their spouse just died. And then if I hadn't given them that space to kind of share what was going on with them, and then that really kind of shifted the tone of our visit. And it was like, well, maybe we can reschedule the diabetic check. And like, this is really what's important for us to talk about today. And so just trying to really listen and see what's going on with patients can open space for things that otherwise maybe you wouldn't be aware of. Some other things that I've learned is that shared decision making can be really helpful. I've always kind of practiced in this way. Some of my older patients aren't used to that. They're like, well, you're the doctor, like just tell me what to do. And I'm like, well, that's not usually the way I'm like used to doing things. But I feel like with a lot of my Native patients, just kind of trusting them and trusting that they know their bodies and they know kind of their environment, and like letting them in on the decision making really can make a big difference. Oftentimes in medicine, what's really cool is there's not just one right answer. Like for example, starting a blood pressure medication, like there's, 3 classes of medicines that are all first line, depending on people's comorbidities. But a lot of times, like the patient can be involved in that choice. And if discuss all the medications, kind of common side effects, maybe they had a family member who was on one of these medicines and died, and they just really have an aversion to like the name of that medicine. And like allowing them in on that decision instead of being like, I'm giving you lisinopril, you have to take lisinopril every day, allowing them in on the decision, and like maybe they're gonna do better on like a different medication if they're like more involved in that decision. um Another thing that that kind of goes along with that is just kind of talking about like my role. And I just say, like, my role as your doctor is to recommend what I think is best for your health. And I'm always going to recommend what I think is best for your health. And, then your job is like you decide what you want to do, but I'm always going to give you that advice and recommend what I think is best. For example, like I have not as many native patients, but some patients who do not want to receive any vaccines. I'm not going to ever stop recommending vaccines. Every fall, I'm still going to ask them about their flu shot, even though I know that like they don't vaccinate, but like that's my job. Or patients who like have been seeing other doctors and maybe haven't wanted to get a mammogram in the past. Like I'm still going to discuss a mammogram with them every year at their physical and why it's important. And I think, patients realizing like that, I'm doing my job by recommending those things, and that like I'm not trying to be pushy. They can still decide what they want to do. But like when I come at it from that way, I feel like they just kind of get that like I care about them, and that's why I'm recommending all these things. Um, Another thing is just kind of really recognizing patients' strengths, and that can go a long way as well. So, for example, I saw a patient who transferred care to me as a new patient, and he had actually been admitted to the hospital this year. Interestingly, he had had a pontine stroke, so he started having some like flashing lights in the peripheral vision of one of his eyes, and he recognized that symptom as something abnormal and came into our walk-in clinic. They referred him to see our optometrist, who identified some findings on the eye exam and then sent him straight to the ER. And kind of the setting was he had had, pretty poorly managed diabetes and blood pressure, hadn't been super excited about being on medications before. But instead of like focusing on that and being like, well, why weren't you taking your diabetes medications? Why weren't you taking your blood pressure medications? I was like, you did such a good job recognizing these really subtle signs of a kind of rare form of stroke. And like how amazing that you know your body well enough to know that like this was going on and you needed to come in. That made such a good difference. Like that's amazing. And he just, I could just see that that meant a lot to him, that I kind of recognized that. um, and then he has started taking his diabetes management a lot more seriously. He got a continuous glucose monitor, and is just like proudly kind of showing me his meter, and like all of his numbers are in range. And I just was like so excited and kind of shared in that with him. But I think that me just kind of starting off the visit of like recognizing, what he's doing well, and kind of like, gosh, when you can put your mind to do something, like you can really do it, and you know your body and you recognize what was going on. Like me just starting off the encounter with that, instead of like, well, why were your numbers so bad? This is why you had a stroke. Like it just set us up for like so much more success. Um, and then I think like kind of building off of that too is just like reframing this idea of non-compliance. I feel like a lot of my patients who I adore and really care about, sometimes like I read their records and it's like non-compliant, Native American patient. And I'm just like, hey, that isn't a nice thing to say about them, like they're really trying. And I think just trying to like get rid of that word and maybe like reframing it in our mind, as like what are their barriers to treatment, what are their challenges to treatment, and like sometimes asking people, what do you think is going to be hard for you to remember to take this medication every day, and like what can we maybe do to help troubleshoot that. Like maybe people are staying at a lot of different houses, like they're not always at the same house every night. And then trying to be like, well, what's something that you do every day that maybe you could tie into that routine of taking your medicine, and just trying to like figure out like what are the challenges, because everybody really does care about their health. And a lot of these patients have seen family members have amputations, have heart attacks, have complications from chronic disease, or substance use, and like they don't want that future for themselves. And so kind of recognizing just that they do care about their bodies. And a lot of times, like kind of just reframing that non-compliance into like, what are the challenges or barriers, and like, how can I help to troubleshoot some of those things?
Fantastic. Thank you, Dr. Aguirre. I love your idea about reframing non-compliance. I think, it really does kind of set the tone when you're reading a note on a patient and gives you kind of this preconceived notion of what it's going to be like to, participate in care for that patient. So I really like that idea. So thank you so much. I noticed that Dee Jansen has joined us. Dee, are you there? Are you able to test audio?
I am here.
Awesome, wonderful. So Dee Jansen is joining us here from Mariman Health. She has been at Mariman for 26 years. She started in medical records and moved through the organization, taking on different roles from administrative assistant to her current role as patient experience manager. Her passion is caring for others and helping them navigate through the process of healthcare. She's not a licensed medical professional, but her years within the organization have built trust and understanding within the community. Her team consists of patient ambassadors, first impressions, and new patient coordinators. She's the first point of contact for the organization. So thank you so much for joining us, Dee. And just a reminder, if you're not presenting, please turn off your video and make sure you're muted. So thank you. And Dee, you can take it away.
Okay. Like my intro said, I've been here within our facility for 26 years and have heard many, many stories throughout my time being here. I think the one thing that I was talking to Dr. Aguirre about this quite a bit is when our patients leave our care to go to another facility, and the words that I get back after they've visited a different, like the hospital or even a specialty at times, is the way that we are perceived by those other facilities as a whole. Like, I don't know why your provider sent you here. I don't see what they see. Just that negative feedback that gets back to our patients. And that causes some distrust, not only, and I said this last year when I was on this panel, that they trust us as being their family friend. Like, they feel like our providers and our staff here are like their friends. And when our friends are saying, hey, I need you to go somewhere else, that you're referring them to another friend. And so when that whole scenario gets broken down and that friend is kind of like backstabbing the other friend, it doesn't feel good for our patients. And we need for, as a collaborative, we trust. We don't have the things that the hospitals do. We don't have MRIs. We don't have CT scans. We don't have ultrasounds. We are family practice, and we trust that when we send our patients to a specialty, to the hospital, it's because we need more answers for them. We need to put them at ease that we're doing everything that we possibly can to help them. But when they get there and they hear, well, I don't know why your doctor sent you here, it makes no sense to me, it breaks it down. That's the kind of stuff that I would love to see change. That atmosphere, that, we need something different. We need to be able to send our friends to meet our other friends and have them feel like they're being taken care of no matter where we send them, if that makes sense. And that is one of the things, as a patient advocate, that's one of the things that I do hear a lot about, is that they didn't feel like they were being listened to, they were not heard, they don't care about them like Tucker does or Dr. Aguirre does, or, that's because they're in a specialty or they're at the hospital, or, they have many, many other people to take care of, where we're more family focused. And a hospital can't be that way all the time. Or a specialty clinic can't be that way all the time. But they're trusting us to take care of them, and we need that trust to be pushed out to everyone. Is there anything else I should be talking about, Dr. Aguirre?
I don't know, Dee, I think you shared a patient experience with me about when there was a really sad outcome for a patient in the emergency room. And then the family was feeling kind of a little rushed. So maybe kind of sharing one of those experiences.
Oh, yes, I do remember. The emergency room is a really, really hard place for our patients to go to. Number one, when they're there at the emergency room, they're normally really, really scared. But there was an incident with family that a very, very sad situation happened. There was a loss of not just the babies, but also the mother at the time. Very young. It's a Native family. As Natives do, they take care of their own. They don't allow the body to be left unattended. They stay with that body from the time of passing all the way through burial. In the hospital, there was, I mean, you could tell that it was very traumatic. The scene was not of roses and rainbows, but the family was coming in and doing what they needed to do to take care of their person. And there were people standing by it at the nurses station, or where the phones and the counters are anyway, in that area, just staring, just watching and not saying anything. Me being who I am, I was a part of that going on. I then walked up to them and asked them if there was something that they needed or if we needed to do something differently. And it was curiosity. It was curiosity that was the reason for the gawking, the staring, the not understanding what was going on. That in itself, I think, needs to be a little bit better explained, about how our Native people take care of those that are going to be set off on their own journeys. It was very awkward, and of course, I got the mom stop it type of stuff going on. Don't do that. You're embarrassing me, from the family that was there. And I don't know how to stop doing that. I don't know how to stop teaching, I guess, or making people feel comfortable. And I asked him, do you have questions? Do you want to know what's going on? I can talk to you about that. And then he felt embarrassed and he walked away. I wasn't trying to be rude about it. I was just like, hey, this is something that maybe if you want to know, let me talk to you about it. Let me tell you about it. Let me hear your curiosity so that you can maybe pass it on to others so that this doesn't happen again. But the family felt like they were being, like, I don't know, just, there was already a hard enough time going on with that family. And then to have somebody just standing there staring at you was just a little too much for the family, to the point where the family, and it's not just that incident, but the family doesn't want to go back. That was a very traumatic thing that happened there, that having them go back to that facility is really hard for the family to even step foot into it. I don't know if that makes sense.
Absolutely. That's really hard. Do you think, Dee, that there is something like, as care providers, I know that you have to step off, so that you have to go back to work. So I just wanted to make sure that I was able to ask you before you got off the call, what do you think would be helpful in that type of situation for the emergency department staff to, like, as far as their behavior? What would have been helpful to that family to make it a little bit of a safer, better experience for them.
I think that you do have some very good staff there. They were consistently checking, making sure, you know, do you need anything? They brought in this cart full of drinks and snacks for the family, took them to a different area for the ones that were in the overflow area, like not in the room, but kind of hanging out in the hallways. Totally understood that, like, let's find you a different comfortable area to be so that y'all could be together. So you do have some very good staff. It's those that I'm sure was new to them. You know, I'm sure it was very disturbing for them to see something like that because it doesn't happen everywhere, right? I don't know. I know you guys have a culture committee that you are a part of. They want to talk about the culture and how Kootenai Health can, you know, encompass everyone. And I think you guys are getting there. I just think that there's just certain things that can be a little bit better. And that is ask. Ask. There's a lot of them that will help you understand. And if they don't understand what's going on, you don't know what you don't know. So if you don't ask the questions or find somebody to help you understand, that stigma is still going to be there. I think the best thing to do is to ask.
Thank you. I so appreciate you for sharing that story with us. These are the types of things that we are trying to, you know, share with our employees and people who care for patients and interact with patients in any way through this lecture series. To just give an idea, there are different cultures out there. They celebrate and grieve in different ways, and to have a better understanding of how that might look for different cultures. So thank you so much, Dee, for sharing with us. And I think there was one comment.
Yeah, we had a comment from Sherry, and Naomi, I think, is echoing that, both of them agreeing that it's such an important story to share, and it's definitely something good to know so that we can work on it. And I think that, just like Dr. Peterson said, that's really the whole idea behind this lecture series, is not to paint everything as rainbows, but that we know and recognize that there are things that we can always be doing better, new things to learn every day, and we just keep improving. Yeah, thank you again, Dee, for sharing that story and letting us know what we can do.
Thank you. Okay. I've got other obligations. I'm so sorry, but thank you for asking me to be here.
Thank you. We appreciate your time.
All right. So next on our agenda, we have Dave Ingebretson. Dave Ingebretson has been serving in the role of behavioral health consultant with Mariman Health since 2015. He previously served as director and therapist for Mariman Health Behavioral Health Department between 1995 and 2015. He earned his doctoral degree in the psychosocial aspects of sport from the University of Utah in 1996, and a master's degree in counseling and guidance from Pacific Lutheran University in 1982. Dave completed a doctoral internship at the University of Utah and his practicum and fieldwork in the public schools, K through 12. He's currently licensed in the state of Idaho as a licensed clinical professional counselor. He's been providing clinical supervision for counseling and social work professionals seeking licensure in the state of Idaho, as well as providing field supervision for clinical psychology doctoral students from Washington State University, physician assistant students from the University of Washington MedX program, and third-year medical students from the Washington State University School of Medicine. He's a master trainer with the Institute of Health Solutions, training providers and participants in emotional brain training skills. Fascinating. So I am so excited you're here with us today and sharing. So thank you so much for joining, and I will turn it over to you.
Great, thank you. Thank you for inviting me, and also to Dr. Geary for inviting me to come be part of this process. And I can't believe I get to work with these two amazing folks, Dr. Geary and Dee.